Hi, everybody. Dr. Misty here. Thanks so much for joining me today and Wellness Wednesday. I hope you all had a nice holiday and good New Year, and hopefully, this year is going to be on the up and up for many of us after last year's and the current pandemic. But hopefully, we're on the up and up and the upswing of it. So, today I wanted to talk to you about different causes of fatigue in trauma survivors. Um, each week, the last couple weeks I didn't do one as I was on vacation with the holiday, but each week typically I do a weekly wellness tips for survivors and how that you can help yourself overcome health conditions and chronic health issues if you are a developmental trauma survivor. Um, so this week's topic is on fatigue. Now, there are so many causes of fatigue in general, but there are different additions for trauma survivors. Okay. So in general, when we're talking about fatigue, this is one thing that typically if you go to um, get help with, the answers that you're usually presented with are, to exercise, to get more vitamin D, to get out in the sunlight, and, do all the natural things that you can to get your energy up. And that's great advice. But for somebody who has chronic fatigue or they're suffering with severe depression and PTSD, those things aren't as easy, for patients to do and just get up and go with those conditions as well. The other thing is that fatigue is usually more complex than that. It's not, that's typically, it's like those kind of responses can really pin the fatigue on the patient versus really looking to solve the problem and help the patient to re-energize themselves. Okay. um, so typically the causes in general, some of the more common causes of fatigue, anemias, iron deficiency anemia, B12 vitamin deficiencies, things like, especially this time of year, vitamin D. Vitamin D is a big deficiency because of lack of sunlight. So people who are not as much in sun, they're going to get less vitamin D. That will create fatigue. Patients who have, um, obviously, who are more sedentary, people who are on computers all the time, and they're having problems getting to sleep because they're on blue light. So they might have that kind of stuff. Sleep apnea. The patient has sleep apnea. I might check patient for sleep apnea. Maybe a hypothyroid type of issue. Okay. Or a glycemic issue with diabetes, things like that. Those are the traditional realms that a doctor might look at for fatigue if a patient just came in to say, like, hey, I've been really tired lately, I don't know why, right? Or they might check for Epstein-Barr, which is like precursor to mono, right? Especially if it has other symptoms to it, like you're presenting like you're sick. Um, for a trauma survivor, there's other levels of to consider. And this is why it's so important, I think, to consider, whether or not somebody is a developmental trauma survivor and people to look at, a patient's ACE scores because, you know, whatever, our your programming and what you grew up with is very much carried into adulthood. So if you are um highly anxious person and you grew up in a chronically stressful environment or an unsafe environment or a very impoverished environment or whatever the case may be, if you grew up in a scary environment, there's who knows, cult activity. There's many different scenarios here that could have been scary, or just a domestic violence situation. Okay. um, but nonetheless, if you're growing up in a self-protective mode and that a developmental trauma survivor grows up in, you're going to be in a chronic state of stress. Okay. And so, what's going to come with that also, and what needs to be looked into, is whether or not the patient has PTSD and dissociation. So, if a patient has um, chronic dissociative issues, that can create a lot of fatigue as well. They go into dissociative states. This is where the patient kind of like spaces out a little bit to not be present, um, so that they don't have to endure the hurt going on around them, or the pain. That is definitely an issue. There's also something with, like, if somebody was exposed to a parent with a cluster B issue, cluster B personality disorder, they might be in what's called in the fog, which is in certain types of emotional abuse, can be extremely energetically exhausting. And so, if a person is in an abusive situation now or has been, they could be very drained from the people around them because they're being abused. That is something that absolutely needs to be taken into account. And so there's a lot of, especially if the person is a lot more sensitive and energetically sensitive and empathic, um, they're going to be taking on more of other people's emotional states, as was learned when they were young. So they'll absorb more energetically. So sometimes it's like the patient is, feeling more of an energetic and emotional exhaustion and drain, or they're giving too much of themselves, with codependent patterns. Okay. Um, and there's also, adrenal issues with patients with chronic fatigue. So chronic fatigue, it with adrenal or hypopituitary adrenal access, basically our body's endocrine system, our hormones, our stress hormones, things like that. When that's getting too hyper involved, you can get into a state, and they found this in literature, even in children in abusive homes, is that they actually show up with lower cortisol levels, which helps. Cortisol really that isn't just a stress hormone; it actually helps baseline um, our circadian rhythm, which is our sleep wake cycles. So a lot of people with PTSD will actually have issues with insomnia because of this. So if they have, adrenal issues in the later stages, they're going to be waking up more with insomnia. They're going to have much lower cortisol levels. They're going to have inabilities to, um, you know, adapt and get on a circadian rhythm. Some people are like almost like flatline. They don't have their body's natural circadian rhythm. So people who have chronic stress states, that's something to absolutely take into effect, into consideration. And one other thing that is really important to take into consideration with fatigue is autoimmunity. So, autoimmune issues can absolutely create a high level of inflammation. So, autoimmune means self attack. If the patient has an autoimmune condition, which is very, very, that's very common in people with high adverse childhood experiences, to have autoimmune conditions. This will create a high level of inflammation within the body and cells, which will create high level of fatigue as well. This is a very heavy type of feeling with autoimmune fatigue. Um, and the other thing to look at too is depression. So fatigue is a very central aspect to depression. It might just looks like the person wants to sleep a lot, but is there a really big depression there? Or is the person suffering on that level? So there's there's things, there's questions you would ask a patient if they were just standard patient coming in with a chief complaint. And then there's more questions that you would ask if somebody is, an abuse survivor, and how long this has been going on, and when did it start, and what's been going on in their life, and where are they living, and things like that. Those are important things to ask. And lastly is mold toxicity, actually. And this goes for both patients, but very under addressed is mold toxicity. Is the person having a toxic mold issue? Those will actually create a really big increase in anxiety and depression, is being exposed to mold. So I think a lot of people during COVID have been working at home, and if they're having a mold issue that they weren't aware of, and then suddenly um, they're breathing in consistently black mold, they're going to end up with high levels of chronic fatigue and anxiety and depression also. So I just wanted to give you a perspective on how big and layered this issue is with people in general, as well as trauma survivors, right? There's a lot more to kind of peeling the onion away when dealing with health. If you have been somebody who is kind of wired for survival, there are things that need to be there's health challenges that need to be absolutely addressed and um, you know, helped with a patient who has high adverse childhood experiences. So I hope you found that helpful and maybe even eye-opening for yourself if you have been feeling like really, really tired over the past year. Things to consider if you are feeling really tired. Usually, if a patient is presenting with fatigue as the biggest thing, there's a series of questions that I ask and go through with them to figure out where to take the next step into helping the patient actually relieve the fatigue, other than just saying like exercise, go outside, do that stuff. That is good advice. It's just that, again, if you are somebody with chronic fatigue or depression and things like that, that advice feels usually creates more of like a defeat or an anger for the patient, because they're like, I want to get there, I want to have that energy to do those things, but I need the energy to get more energy. So like, where do I find the initial energy to just get up to get the energy to get there, right? um that's one of the biggest things with people who have mentioned, and I've felt it myself with chronic fatigue, is like, it's got to be taken in little steps, in little baby steps, and it has to be addressed properly, that the patient is getting some of their symptoms addressed by other biochemical issues that they're having, such as the mold toxicity, such as the deficiencies, such as things like that. There needs to be some digging so that the patient can get some relief in their energy back in order to do the other aspects of the natural stuff. So um, again, I hope you found that helpful. If you feel like this is you and you feel like you have been extremely fatigued, you've been to multiple places and you've gotten lab work and everything is coming out okay, and you just don't understand what's going on, please reach out to me. You can message me. You can also book a discovery call with me. It is a free 15-minute consultation to see if I am the right person to help you. And if I'm not the right person to help you, I will usually tell you where or guide you where to go, or give you some tips on what might be helpful for you. When I typically work with, trauma survivors with complex health issues in the realms of chronic fatigue, fibromyalgia, autoimmune gut issues, Lyme disease, a multitude of chronic complex issues. So if that sounds like it's in your realm and you'd like some help and guidance with further testing and further help to feel better, I'd love to help you. You can visit drmisty.com. All my information is on there, or you can shoot me a message. Please make sure to hit those notifications and like this video if you found it really helpful or validating. And I will see you guys next week on Wellness Wednesday. I hope you have a great week.